Folks, we have a great gift in the Oakland area in Lisa Skipper. Let's give her another round of applause. Navigating the marketplace is a challenge, and she does it with such grace and such benevolence. It's amazing. And also, the whole staff here at Mountain Laurel, I know you probably know some of them. Some of you know more than others, but I haven't met a bad apple in the bunch. So let's give them an applause. Working with them has been phenomenal. So I want to do a little poll before we get started here. I wonder how many people are here because they're somewhere. You don't have to vote if you don't want to, give up any private information. But how many of you are turning 65 or you're around 65 and you're interested? Okay. Okay. Let me ask you this differently. How many of you are on your 35th anniversary of your 30th birthday? All right. Does that make it a little easier? Okay. How about people that are on group insurance? They're going to be coming off group insurance at some point. They're wondering how that works. It just tells me a little bit what I need to focus on. Okay. How many people are here for the food? Okay. They told me that I could eat if I spoke, so that's why I'm here. No, that's obviously not the truth. The reason I'm here is because I believe education empowers. Education empowers against confusion, against bad information, and against bad actors. Right? People that are calling you and they're like, hey, we got you a $1,000 a month grocery card. You know that there's something sketchy. So we want to give you information now. There's an unwritten rule amongst insurance brokers who do seminars, and it's you only give like 60% of the information. Why? Somebody guess? Because we want you to come see us. Well, I don't play that game, okay? I'm going to try to give you everything I possibly can in the amount of time I'm allotted. You'll probably feel like you took a drink out of a fire hydrant, but I do want to earn your trust so that if you need help, you feel like you have someone you can trust and can see. But we're not going to just give you enough that you want to come talk to me. We're going to try to give it to you all. We do want to talk about Medicare and putting the puzzle pieces together, because when either you're going on Medicare or maybe you've even been on for a little while, you feel like you don't have the complete picture. Some of the puzzle pieces are upside down and some of them are on the floor. We want to at least get them on the table and get them flipped right side up and help you put the puzzle together. All right, so I talked about bad actors and, how can you trust me? What can I do? Well, I'll tell you, this is the first thing. I have a large family. You're like, well, how does that help me trust you? Well, there's a lot more of them than there is of me. So if I was a shady character, I probably wouldn't be here today. All right. I'm sure in this room there are some stories of kids and grandkids. Probably some of you all have fantastic stories. I wish we had time to just go around the room and hear stories of great things that your kids and grandkids or maybe even yourself have done. I get to brag a little bit and show some pictures, but earlier this year, my daughter Mariah got engaged, and in 2 weeks, she's going to get married. Really excited about that. Last week, we were in Alabama where she earned her wings as an Air Force pilot. So super excited about that and super excited about her wedding. And so we are really focused on the education. And so we don't want you to miss that. What we're trying to do here today is not just help you, and I hope you'll think a little bigger than just helping yourself. As I think of Mariah serving in the military, she's flying helicopters in Minot, North Dakota. Oh my goodness, going to be cold. But, part of the military, she gets paid for it, but she also serves others, right, and serves the country. And we want you to serve each other. So when we give you information, we want you to be able to take that information to a neighbor, to someone else, not just for your personal consumption. We obviously want you to be well educated, but we want to bring up the education because so many people have so many questions. So when you work with someone, I'm going to talk a little bit about working with someone. This isn't meant to be self-serving. I just think there's a very simple recipe when you work with a broker or an agent. The first is the first ingredient in the recipe should be connection. You need to work with someone that connects with you and you connect with them, meaning that they're available for you, right? You need to be able to get a hold of them. They need to make it a priority to communicate with you changes and things like that. So you want whoever you work with, make sure that you connect with them. Don't settle for someone that you'll never talk to again, because you probably are going to need some help. The other is education. Obviously, we're doing this because we believe in education. And then the last is protection. And the reason I bring up protection is what protects us with insurance is the plans we sell and the companies we sell. And there are folks that will market you that sell one company. And guess what they have to do? They have to get you to like their company. So try to work with someone that has all the options. They carry all the Medicare contracted companies, because then they have more of an opportunity to do shopping for you. Does that make sense? Everyone get that? So it's a difference between a broker and an agent. And I am a broker, but of course, I'm not saying just work with me. I'd like that, but work with someone who carries all the products. All right, this is our team. And you know, most agencies have a couple admins and a lot of agents. We have a couple agents and a lot of admin because it's about the complete package. So I am bragging here for a second or speaking about ourselves, but we believe that it's not the policy only, it's the packaging, which is the people that facilitate that policy getting in place. We actually just talked on the way down this morning. We're wanting to implement a welcome to Medicare call. So on the day you go on Medicare, we call you and say, hey, it's okay. It's going to be okay. Everything's going to be okay. All right, I'm a certified Medicare insurance planner. I'm not exactly sure what that means, but I can tell you that I had to verify that I'm not a bad actor, that people haven't started picket lines outside my office, and I've been doing this for a long time. All right, so let's talk about today's topics. First, we're going to talk a little bit about the history and the structure of Medicare, sign-up times, 2 delivery methods. We're going to deal with Medicare Advantage and Medigap a little bit differently, as in that there are 2 delivery methods. We want to clear that up for some folks. Limited income help, and then upcoming changes. I am going to try to weave the upcoming changes into the other things we talk about. All right. Short history, 1965, President Lyndon Johnson, his Great Society initiative enacted Medicare. It was for 3 different groups of people. All right, obviously turning 65, and then also under 65 with certain disabilities and end-stage renal disease. I will say this, the under 65 crowd, if you're in Maryland and West Virginia versus PA, I don't think anybody's here from PA. No one, okay. All right, so there are some significant rule differences with particularly the Medigap policies if you're in Maryland or West Virginia and you're under 65 but on Medicare. We'll try to talk about that a little bit. But most folks would be aware of this, but if you are on disability for 24 months, your 25th month, you automatically are enrolled in Medicare, and that catches some folks by surprise. You also have to be a legal U.S. resident, and you have to have a sufficient work history, either your own work history or a spouse's work history. And the spouse that you're going off of their work history they either had to sign up for Medicare or their Social Security retirement benefits to use their work history. Now, eligibility is determined by Social Security as well as the facilitation of the premium payments. So sometimes you may wonder, why am I getting it mailed from Social Security when I'm talking about Medicare? Well, Medicare facilitates the payments of claims. Medicare facilitates your really the payments of claims is the big thing. Problems facilitates the annual information that you get, the Medicare and You book. But the Centers for Medicare and Medicaid Services, they're the ones that take care of the billing, but Social Security, the payment of claims and bills from the facilities and providers. But Social Security is the one that administrates the billing. So if you have a problem with your billing, and we're going to talk about that in a little bit, because some folks who go on Medicare end up paying an exorbitant amount for their Part B, and they have to work with Social Security, not Medicare. And I want to make that distinction. So Medicare takes care of the claim payments and providing the printed material for Medicare, the Medicare and You book and whatnot. But Social Security administrates all the actual premium payments for Medicare and the eligibility for Part A and Part B. All right, so talk real quick about the parts of Medicare. We're going to go through this a little bit. What I tried to do is do a little bit of duplicate slides so that we're going to touch this, and then we'll come back a little later. I think the hitting it twice will maybe help us. But Part A is your hospital coverage, your skilled nursing facility, and your hospice care. Now, I want to make a comment about your hospital coverage. It's just a facility and maybe the janitor, I don't know, but it's It's not the medical things that go on in the hospital. Those are covered under Part B. Now, in a skilled nursing facility, it's a little bit different. Of course, if you need medical care, that's going to be billed under Part B, but your Part A is going to cover like your physical therapy and things like that. So it's typically no premium for Part A. Again, based on a work record, you have to have 40 credits of work history. You can purchase it in certain situations, and there's actually a designation for low income for someone who doesn't have sufficient work history, doesn't have the income to pay for their Part A. There's a government program to help pay for the Part A. Part B is your medical and surgical services. It says physical services. That's supposed to be physician services. My iPad apparently spelled correct. Don't you love that? It was a right word before I wrote that. But physician services, therapies, labs and tests, durable medical equipment, outpatient hospital procedures, blood transfusions, and injectable drugs often given in an office setting. Those are what are covered under Part B. So on your card, you see Part A, it says hospital, covers a little bit more than a hospital. Then Part B says medical, and those are the things that Part B would cover. Now, of the parts of Medicare, I'm going to throw you a little bit of a curveball, but I want you to absorb it, and maybe we'll have a moment of silence to think about it. But Part A and Part B are the only parts of Medicare that are facilitated by the government. Only A and B are facilitated by the government. C and D are facilitated by private insurance companies that have a contract with the government. Okay? That's a little bit, can be manipulated by those shady actors to try to say, oh, we're from Medicare and we're talking to you about Part C or Part D. That's not ever going to happen, okay? These last two, the C and the D, are private companies. So only A and B are administrated and facilitated by the government. C and D are private companies. All right. No one has all parts of Medicare. No one can have all parts of Medicare. You cannot have, it is illegal for me to sell you all parts of Medicare. Okay, we're going to talk about that. But I want you to understand that because, again, you may have Medicare, original Medicare, and a supplement, and then you may have someone call you and say, boy, we got a grocery card. When people call me and tell me they got a call, I'm like, well, I'm not a grocery salesman, so I probably can't help you. I'm actually not an over-the-counter salesman either. But there are plans that provide those, and man, if you can get that, we'll help you get it. But what they don't understand is they have to give up something to get something else. And a lot of times what they gave up was not what they saw coming. Okay, so no one has all parts of Medicare. All right, so of the parts of Medicare, when we talk about Part C, I always use the illustration of it's subcontracted Medicare. All right, so, you know, I talked to, in this area, well, I grew up on a dairy farm, there's lots of farmers, and, you know, some big farms, they actually drive their own milk trucks, right? They haul their own milk. But a lot of the smaller farmers, they subcontract out the milk hauling. Okay, so the idea is Medicare is subcontracting to a private insurer your Medicare coverage. Does that make sense? Okay, so you're now not dealing with Medicare and their explanation of benefits and their plans. You're working with a private company and dealing with them. Okay, so it replaces Medicare. You still pay your Part B premium. Although I will say this, and I have I'm not following my notes because I needed to be quick, and so I just am trying to throw some things in here. But if you are a veteran and you don't use prescription coverage except through the VA, you have VA prescription coverage and that's what you use, there are plans that will pay part of your Part B premium for you. And so that might be something you're interested in. Can't get into that anymore now, but you can talk to me afterwards if you need to. Okay, when you have Part C, you now have network considerations because Part C plans are, again, a private company. So they're going to contract with certain physicians, and then they may offer fairly good out-of-network coverage, or they may offer no out-of-network coverage. You have to pay attention to that. And don't think that I'm downing Advantage plans, but it is one of the realities you have to deal with. And then the benefits can change. The benefits can change year after year. Now, they can't go off the deep end, so to speak, because Medicare has guidelines that if they're contracted with Medicare, they have to follow those guidelines, but they can change, where with original Medicare, of course, you have the same thing every year, all the time. Now, some people say Advantage plans are horrible, awful, I've heard terrible things, and no one should get an Advantage plan because they're so awful. And I would say the answer to that is true, false, false? I'm not true or false? I don't know. Okay? Well, the reality is that answer is correct both ways. You have to pay attention to the company. There are companies that have lawsuits against them. There are companies that part of their business model is to deny so many claims per year. You probably want to stay away from one of those companies. You want to, work on finding, if you do look at Advantage plans, look at a plan that provides good coverage and has a good network and is reputable. And I'm going to back up because I didn't want to bring that up and I couldn't remember how soon it came up. But we said benefits can change on the Part C. Also, cover services may vary and typically includes Part D. So this is why you can't have all parts of Medicare. If your Advantage plan includes Part D, you can't get a standalone Part D. If your Medicare Advantage plan doesn't include Part D, you better be getting your prescription coverage through the VA because you can't even buy a standalone prescription coverage if you have Part C. And so that's where people, Ms. Jones, I hope no one's in here, Ms. Jones. If you are, I apologize. But Ms. Jones, it's not because I know you. It's just because it's a good generic name. Ms. Jones, we got this grocery card, don't you want to sign up? And of course, if you're in Maryland, you give them your zip code. Most of them just hang up on you because they realize it doesn't apply to them. But if you do live in a place where that plan's available and they sign you up for what you think is just an additional benefit, it actually is going to kick out your Part D if you have that in a supplement. And I'm not going to say any more about that now because we'll talk about it in a little bit. Okay. Prescription coverage, Part D. So we went through A, hospital. B is your medical services. C is outsourced Medicare. And D is prescription coverage. Prescription coverage is, again, provided by private companies. The federal government does not require them to cover every drug. They do require them to cover 5 drugs in every therapeutic category or something like that. They require them to have a robust formulary. The formulary is the list of covered drugs in a prescription plan. Very important when we talk about max out of pocket later on. Now, the selection of a drug plan is based on the prescription list, your preferred pharmacy, and your personal financial considerations. So obviously people take different medications. They need different prescription plans to cover them. Your preferred pharmacy, some of us like to go to local pharmacies. We work really hard to find a plan that balances cost, coverage, and the pharmacy you like to go to. And when we talk about personal financial considerations, talked to someone earlier, they get some assistance with their prescriptions through the government. It's called low-income subsidy or extra help. And when they get that, you don't typically need an expensive drug plan, even if Medicare.gov, if you've ever gone on to Medicare.gov, and it says, oh, you need the expensive United Healthcare drug plan. Well, no, you may not if you're getting additional assistance because it will lower the max you can pay for even brand name drugs. So you definitely want to take that into account. The other thing, at the very end, we're going to talk about the Maryland Senior Prescription Drug Assistance Program. It's a very generous program that pays for anyone's prescription plan who, as a household of 2, makes under $63,120 a year. So it's a very generous limit for a household of 2. It's around $45, $46 for a household of 1, but it will pay up to $75 towards your prescription plan. So sometimes people are getting killed because they wanted a cheap plan, and so they have all these copays when they could have bought an expensive plan. The state of Maryland legitimately would have paid for all of it or most of it, and they would have stellar coverage. So we have to work through those things. You have to, whoever you work with, make sure it's someone that works through that part of the plan choices that you go through. Okay, so there's one other part that's not really part of Medicare, right? It's not A, it's not B, it's not C, it's not D. I did list it under the parts of Medicare. because it's definitely one of the puzzle pieces. And that's Medicare supplements, okay? You can't have that with Part C. As a matter of fact, every once in a while, I have someone that gets their Part C and they're like, oh, good, I've got double coverage. And if your Part C is a zero premium, and we'll talk about in a second why it's zero premium, they're like, oh, this is great. I got double coverage. Sorry, no, you don't. When you get your Part C, it shuts off your Medicare card. And if your doctor bills Medicare, it will come back as a denied claim. And guess what? Your supplement will then deny the claim because Medicare denied it. Okay, so please understand that if you get a Part C plan, make sure you understand that it's not double coverage. You will have to cancel, or you'll want to cancel your supplement and your drug plan. Well, your drug plan will cancel automatically, but your supplement won't. Sometimes people are convinced over the phone to switch to a Part C plan. And maybe if you're in, well, either state, Maryland or West Virginia. West Virginia has a lot more options. I think they have 28 or 33 options, and depending on which county you're in south of here. I think this county in Garrett County, I think there's 10 Advantage plans. Pennsylvania has 66 Advantage plans in Somerset County. But anyway, regardless of where you're at, if somebody would convince you, and I'm not saying they were being illegitimate, but they said, hey, you should get an Advantage plan, and you agree and you sign up, if they're a reputable agent, you'll know right away because they'll say, hey, ma'am or sir, you need to remember to cancel your supplement. Because if they're just in it for them, what are they going to do? Thank you very much, and they're going to get the auto dialer to bring them someone else up, and they're not going to tell you to cancel your supplement. And I run into people every year that they're wondering why for 2 years they've still been getting billed for a supplement because they thought their Part C was going to replace it. Well, it did, but the company was happy to keep billing them. And honestly, it's not that the company even knew. So just a lot there with Part C. Just you don't want to have Part C and a Medicare supplement. Okay, prescription coverage then comes when you have a Medigap plan. Prescription coverage comes through your prescription plan, the standalone prescription plan. And again, it's based on those same selections, just like your Part C. When you choose a Part C plan, you want to make sure the Part C covers your drugs based on your prescription list, your pharmacy, and financial considerations. All right, one of the big reasons Medigap policies are so popular is if a doctor anywhere in the country accepts your Medicare, it's going to accept your supplement. Okay, so I'm not here to talk about plans. I'll use this as an illustration though. Erie has a Medicare supplement. The reason I'm using Erie is simply because it's a regional company, right? They're not in Texas, they're not out west, they're just on the East Coast. And so people are like, well, you know, Erie, and Erie tends to have a very good price, so, you know, people are looking at that some, and they're like, well, if I go to Texas, I got a granddaughter in Texas, you know, doesn't matter. It doesn't matter if you have Erie, doesn't matter if you have another company that's regional, it's gonna work anywhere Medicare. Now, that was not a plug for Erie, please understand, but just an illustration of a regional company that has a supplement that works nationally. Okay, so you don't have to worry about the network. And then the coverage, now, one of the things that the Big Beautiful Bill does is it's going to start to bring in some cost measures to actual Medicare, something that historically only the Advantage plans have done. You're going to start seeing that quite a distance in the future, that there's just some cost control, because up to this point, if the doctor says it's necessary, it gets paid for by Medicare. Now, that doesn't mean they don't need to get some pre-approvals and things like that, but it's basically a medically necessary explanation of benefits. And so there will be a little bit of that. I don't anticipate it to be any kind of where you're just not going to get the care you need. Be just like an Advantage plan, unless you're with a company that makes their money off of denying procedures, you're going to, you know, get approved for a procedure that's medically necessary. Okay, so we've gone through the parts of Medicare, Part A, Part B, Part C, and Part D. So just to recap, Part A and Part B plus a Medigap and a Part D plan is one way to get your coverage, okay? And the other way is a Part C plan, but you're not going to do both. You're either A and B, Medigap, and a Part D. Now, some of you may be low income and you're like, well, I just have Part A and B and I'm fine. So there are programs. And we're going to talk about them again if we can get to it, but the qualified Medicare beneficiary, the specified low-income Medicare beneficiary, those plans, and full Medicaid, so it would be the QMB, qualified Medicare beneficiary plus, that would be considered full dual. They actually, the state comes in and helps pay for what Part A and Part B don't. So there is the possibility to exist if you're low income in that state. Otherwise, there's no max out of pocket. There's no cost controls with just having Part A and B. All right. Now, we're going to skip through a bunch of these slides because I don't have time. But a lot of you grabbed this brochure. If you, and I don't think anyone said they were looking at coming off of group coverage, but a lot of people who are on group coverage, this is a tan one, so it's a little different than that one, but they wonder, how should I navigate my group coverage? Well, this is a handy little tool to help them. It's basically as easy as yes and no. And so you're able to say, I'm eligible for Medicare, I have group insurance. No, apply for Medicare. Yes, do you want to stay on your group insurance? No, well, are you newly eligible for Medicare? Yes, you just apply. B, we have to do some extra legwork. We spend a lot of time helping people who are already on Medicare Part A, but they need to get their Part B. We help them get their Part B without penalty. It's not like we're magicians. It's just one of the things that Form L564, I wondered if this would show up. No, it doesn't. Okay. That Form L564 here has to be filled out correctly. One of the problems that sometimes you run into with Social Security is, of course, you're sending this to Social Security, right? They're the ones that administrate the eligibility for Medicare. So you send that into them. The L564 was filled out wrong, and nothing happens. You don't get a notice. You don't get mail. It's 2 months into when you were going to leave your group coverage. You're slogging it out, at your employer, or worse, you already retired and now you don't have coverage. So I would strongly recommend you have someone. Again, I do this, but just find someone who will look over your L564. The other issue is sometimes you'll have a group company and they will, what time are we supposed to be done? 12:30? One day. I think we'll have to get some dinner and some yogurt for breakfast. Anyway, oh, good grief. What was I saying? Oh, so the L564, let's say you were at a company and you're 71 and at 68, they changed hands and they got new group insurance. So the HR person who's filling out that form, they're going to put a date of when? Probably when they switched hands. That leaves you with 2 or 3 years without Medicare or without any kind of qualifying coverage as far as Social Security is concerned. And so they're going to send you your stuff, and then you get this whopping bill in the mail because you'll get a letter that says your application was denied. You got to wait till January during the general enrollment period. All because somebody made some wrong dates on a form. So have somebody look over your L564. Again, those, we will send you one if you need one of those. Just sort of helps if you run into someone who they aren't sure if they should just get their Part A, Part B. We'll help with that. If we have questions, I need to click through this some more. See how much time I'm saving? Doesn't everyone feel like they're getting younger? All right. Now, sign up, enrollment. If you're already collecting Social Security, congratulations, because you're automatically enrolled in the original Medicare. But there's two dangers. One's more of a danger than the other. But it comes 3 months before your birthday. What else are you getting 3 months before your 65th birthday? A dump truck load of mail every day, right? And it's all made to look official, so you open it and you find out how you can get your free groceries or something crazy, right? So every month I have people throw away their Medicare card because they got throw it away itis, and I don't blame you. You get so much official looking mail. So just know that if you're collecting Social Security or someone you know is, that they're going to get their Medicare card automatically. The other danger is, if somebody's collecting Social Security, they usually aren't working enough to have group coverage. But if somebody is, and they want to stay on their group coverage, then they have to send their card back. They have to sign it and send it back saying, I don't want my Part B, I just want Part A. Okay, if you have creditable group coverage, which most name brand group coverages are, you can just get your Medicare Part A with one provision. You can't be you can't be contributing to a health savings account because you'll get penalized because you can't, that's sort of a government subsidized tax shelter, right? So you can't be doing that and go on Medicare. So if you're going on Medicare, you want to make sure you're not contributing to an HSA at work. And one of the trickiest parts of this is, let's say you delay your Medicare for a year and you're donating to an HSA for a year, and then you apply, your Part A is backdated 6 months. If you delay your Part A and Part B coverage, your Part A will be backdated 6 months. There's no way to stop it. It's going to be backdated all the way to your birthday month. Of course, it's not going to go before your birthday month, but it'll go back to your birthday month. So if it goes back and you've been contributing to an HSA, you've got 6 months of contributions that are going to be penalized because you shouldn't have been contributing when you were Part A eligible. It's a inverse loophole. Yeah, it's a government loophole, actually. So again, Part A, we already went over this. Typically, zero premium, dependent on your work history. And the Part B premium is $185 in 2025. It's typically, since you were already collecting Social Security benefits, it is going to just come out of your Social Security check. Now, higher incomes, general rule, please don't hold me to this, but if you're a household of one and you're a little bit over 100,000, you may see a bump up and then it continues. There are different income increments. If you have a household of two, then it's a little over $200,000. You're going to see a bump up in that 185. Now, some of you, this may apply to. If you were working the previous year, you and your spouse both had jobs, or maybe you just have you work for Mountain Laurel, and they just make bank here, and so you actually are over the income threshold, but now you've retired and you're not. There's a Social Security Form 44 that tells Social Security, hey, I've had a life change. I'm under the threshold. And we can get that stopped so that they don't go off your taxes from the previous year. They go off of your current income, what your estimated income is. Now, obviously, if you're not honest in that, or there's an oopsies, you're going to get it taken off a year later when the IRS gets your tax forms submitted over to Social Security. They're going to say, oh, no, you shouldn't have been reconsidered for a lesser expense. So 185 is typical. If you are charged more than that because of higher income, if that was a previous year's higher income, there's a solution for that. Okay, if you're not collecting benefits, you have to manually enroll in Medicare. So again, I won't ask a show of hands, but probably some of you have SSA.gov accounts. Some of you don't have those accounts. And some of you are the happiest people in here because you don't even own a computer. And I envy you greatly. But we help with the enrollments. We obviously can't create an account for you. I don't work for Social Security. But we can help you if you want some advice. Put me on speed dial and say, hey, I'm trying to get my account created. I can't figure it out. My first advice might be get a hammer. But then after that, I'll settle down and we'll get to work. But you can call and set up an appointment. You can go in person to a Social Security office. But again, if you get that online portal, you can sign up for Medicare. You can sign up for retirement benefits. It's a very handy tool. Now, if you're not collecting, guess what? You get billed for your Part B. And your Part B is billed quarterly. But if you applied right at the end of when you were asking Medicare to start, and then the person who was assigned to your case went on vacation for 3 weeks, and so it took you a month extra to get your Medicare, they're going to backdate, right, your Medicare to when you first requested it. And then they're, of course, going to backdate all the premiums. And so I've seen people be billed 5 months at one time. So obviously, if you do it in a timely fashion, that helps the bank account. The other thing is you can set this payment up for monthly payments by going to Medicare.gov. Different than Social Security.gov, Medicare.gov, and you can set a automatic withdrawal out to pay your Part B premium right out of a bank account. I actually think you can use a credit card. Okay, so this is one of the big, so we are now talking about the two delivery systems. How am I going to get Medicare? And I'm sure there's people in here who have Advantage plans. There's people in here who have supplements, and probably both of you are wondering, what's the other side look like? I want to peek. Well, we'll try to give that to you a little bit. So again, this is the way the delivery systems work. You'd have original Medicare, Medicare supplement, and a prescription plan. The only reason you wouldn't have a prescription plan is if you were a veteran, or maybe there are certain situations where I've seen someone be on a spouse's drug plan only. Some group insurances, the drug plan's a separate component, and they can use that drug plan. And typically, Part D plans with a group prescription plan can be a little stronger than Medicare. So that's something to consider. But typically, that's what you have when you have original Medicare. Or you have the Medicare Advantage that combines Part A, Part B, and D. Also, it combines some additional benefits like dental, vision, and hearing. And those are legitimate offerings. You just have to be careful of what you're giving up to get those. You don't want to just say, oh, I want dental and vision, so I'm going to give up doing a supplement, and I'm going to go with an Advantage plan. Make sure, because it's the whole package, you have to take all of it. All right, so Medicare supplements, lowest out-of-pocket cost. I'm going to give you some illustrations, 2 illustrations that help identify that. The Part B premium, of course, you still have to pay Part B, plus you have to pay for the supplement. And don't hold it against me, but I am going to give you some general costs so you can figure that in, even though, of course, your specific situation would be needed to consider to verify exactly what you would pay. And I will say, some of you, I know you're looking through the slides. I apologize. Not all the slides are in there because I wanted to save on printing, so some of the duplicate slides I got rid of. So I apologize if it's making it a little hard to follow. Network. Choose any doctor that is contracted with Medicare in the U.S. No referral typically needed. And Part D, I say typically because sometimes the specialist requires a referral, right? If they require a referral, then you need one, but it's not going to be driven by Medicare. And then your Part D, you choose a prescription plan from a standalone prescription drug company. Higher out-of-pocket costs when seeing doctors or hospitals. Now, your doctor might be zero in an Advantage plan, but most of your services, other than preventative, are going to have co-insurances. What you have to determine is, okay, if I'm paying my Part B premium and a smaller premium for my Advantage plan, does that offset the out-of-pocket costs that I'm going to have to pay with the Advantage plan? So you're going to also have the network that you have to pay attention to. So that really sums up the two. So Medicare supplement, lowest out-of-pocket, you're going to pay your Part B premium and then another significant amount for the premium for the Medicare supplement, but your network is as big as Medicare's, and your prescriptions provided through a standalone company. Medicare Advantage, higher out-of-pocket costs for utilization, okay? So sometimes people say, hey, I'm very healthy, would an Advantage plan work with me? Well, yes, it would, just like it would work for anyone, but you're buying it for now and later, so you have to pay attention to that. We're going to talk about the enrollment with Advantage plans and supplements that will clear that up a little bit. Part B premium, $185 for this year, but then your Advantage plan premium is a lot of times how much? So a lot of times it's $0 or it's $10, and you're like, that's snake oil. This guy's selling me snake oil. Well, no, the reason it's so inexpensive is, remember I talked about Advantage plans being outsourced Medicare or subcontracted Medicare? Medicare is sending that plan a boatload of money to take care of you. And they're like, hey, they're getting enough money. We're getting enough money from Medicare. We don't need to charge Ms. Jones $12 or any amount of money. So we're just going to call it a zero premium plan. So when you get a zero premium Advantage plan, that's because Medicare is paying them on your behalf. I think it's between $800 and $1,000 a month they send to the Advantage plan. So that limits how much your Advantage plan would cost. And please, a side note, please don't buy an Advantage plan thinking that the more expensive it is, the better coverage. There isn't anything less true than that, okay? Please don't buy the Advantage plan because it's more expensive thinking it's better coverage. I guarantee you, particularly in this area, it's not the case. All right, so Medigap plans, Medicare supplements, the word Medigap and Medicare supplement is synonymous, so I'll use them interchangeably. But we're going to go back to talking about the Medicare supplements then and what plans are available. Now, there's 10 plans up there available, and you're like, well, man, I haven't heard about Plan D or L. My agent held up or was holding out on me. Hopefully I wasn't your agent, but even if it was, I wasn't holding out on you. The reality is that there's reasons that we don't look. You typically talk about Plan G and Plan N, and here's why. One is either gaps in coverage or 50 or 75% coverages. I couldn't imagine trying to figure out if I was being billed correctly, if I was being billed something that I had to figure out what 50% is. And guess what? You do have to track that stuff because your provider is prone to some errors. I shouldn't say prone to errors, but they can make errors. The other is C and F. Now, if you went on Medicare before January 1st, 2020, on or after January 1st, 2020, you can't have C or F because the Part B deductible is covered, and we no longer can cover those. However, I didn't sell a lot of C and F when it was available because if your Part B deductible this year is $257 and you could go get a Plan F, you're going to pay probably around $400 more a year to get the $257 covered. The math doesn't work, right? So I didn't sell. I mean, some people just were like, oh, I want something that covers everything. Okay. But now we don't even have that option. Unless you were on Medicare before January 1st, 2020, C and F are no longer available. And then D and M, there may be a company that carries them yet, but D, M, and N were very, very similar coverage. And so really most companies, over the years, standardized and went to a Plan N. So that leaves us with Plan G and Plan N that are the typical coverages that are sold as Medigap plans. Okay, so when's the best time to enroll in a Medicare supplement? Now, just so you know, we're going to talk a little bit more about comparison between G and N. That was just talking about why we're only going to talk about it. But let's talk about the enrollment because it has to do with a little bit whether you would choose G or N. First, the best time to enroll is up to 6 months prior to your birthday month. You can enroll. Now, if you're in West Virginia, that's only 90 days. But in Maryland, PA, it's 6 months. If you get a call from someone at 5 months in or someone shows up at your door, which I know happens around here, and they say, it's 5 months from your birthday and you haven't signed up for your supplement, the sky's falling. No, the sky's not falling. They just think if they get you, no one else can have you, right? The sky's not falling. I tell people, just call me when you get your Medicare card if you're signed up. Some people, want to take care of it earlier, and that's fine, but there isn't any panic. Don't be panicked if you're 3 months out and you haven't done anything yet. We've done people the day before their birthday month. Do they have their cards? No. Are they covered? Yes. Okay. I don't recommend that, by the way, but we have done it. All right. Now, here's the most important thing you need to understand about anything with supplements. You don't want to sign up any later than 6 months after your Part B effective date, or you have to pass medical underwriting. Okay, so if someone says, hey, I'm going to try an Advantage plan, and if I don't like it, or 5 years down the road, doc says, boy, your heart there, I don't know, you might need some additional help. You're like, that's when I'll get the Medicare supplement. Well, no, you won't be able to get it at that point because you couldn't pass underwriting. So sometimes people go with supplements simply because they're looking down the road and they're like, I know statistically I'm going to have to doctor more when I'm older, and so I'm going to buy that now so I have it later. That's one way of thinking. It really does come down to preference because some people would prefer to save all that money while they were healthy, knowing that they're going to have more expenses as they get older and would have more medical procedures and things like that. But it certainly is preference. It is not my job to tell you what your preference is. And if you sit in front of anyone or you're on the phone with anyone and they try to tell you that this is what your preference should be, or if you have an Advantage plan and they try to talk you into a supplement or vice versa, it's your preference. Be confident about that. It's your preference, all right? Maryland is a little bit different in that you can change the 30 days after your birthday through the Maryland birthday rule, which means if you have a Plan G or if you had a Plan F and you're like, I wonder if I could save money with, I don't know, Acme Insurance. And you've got Yankee Insurance. You want to go to Acme. And so you can't change because of a medical condition. If the effective date's 30 days after your birthday, you can change. Now, the reason I brought this up in the interim between G and N is if you say, well, I'm going to start with N and later on I'll roll to G, you can't go up in coverage. The birthday rule allows you to go laterally or down in coverage. Okay, so if you have a plan F, you could go to G and N. If you have a G, you could go to N. If you have an N, you're more likely just going to roll to a different N. That is something to consider. It's a guaranteed issue that only Maryland has. So the caution is, if you're in West Virginia, try to choose your supplement. One of the considerations would be, how much does it go? Well, that would be with any state, right? But how much does it go up? Is this company known for its price increases? Because in West Virginia, you're not going to be able to roll to a different company if you have health concerns, okay? I know that's a lot to digest, and I apologize, but you definitely want to understand that Maryland does have this little window for changes. West Virginia and Pennsylvania does not. Standardized plans, you're not buying the company. Not totally. You're not buying the company for the coverage. Now, you might go with a company that isn't known for huge price increases. It's not known for bad customer service. It's one that you maybe you've seen situations where someone else had the coverage and they weren't happy with it. I mean, all those things go into how you make your decision, but you're not choosing the company because of the coverage. Okay, that's already settled by the plan letter. You're choosing the company, I don't know, by maybe their logo colors. No, it would be basically, again, what I said, starting premium would be a good place to start, but I wouldn't recommend getting the absolute cheapest company. Why would that be? Well, yeah, price increases, but if it's a company that no one's heard of, the only reason anyone buys them is why? They're low price. So they're going to have to play catch up later on at whose expense? Your expense. And so we try to stay away from companies. There's always companies coming into the area that are less expensive for a few years. And then here's what happens. Remember, I told you I'd give you all the information. I'm trying to. In a few years, they will change their name. It's happening right now with a company that some of you have supplements in here, I'm sure somebody has that supplement. They are changing their name. No, they'll never tell you that because you have the old supplement. But why do they do that? Because their price increases are going to start to skyrocket. Well, they wouldn't be able to sell any policies because everyone would say, stay away from that company. And so they change their name. And then they start selling again at a low price. And if you have medical conditions, you can't change as easily. You can change in Maryland, but West Virginia, Pennsylvania, you can't change. So just be careful the companies you choose with the Medicare supplement policies. And there's 3 states that aren't standardized. They do things a little differently, none that are around here. Okay, so what's the average Medicare supplement rates? Between 100 and 180 per month. If you're in West Virginia, that 100's pretty accurate. On the low side, if you're in Maryland, the Plan G, that's probably a little bit low. It might maybe be 190. But that's a good new to Medicare cross-section of rates between Plan G, Plan N, male, female, turning 65. Again, the rate is based on the plan letter. Is it G? Is it N? Zip code, are you Maryland, West Virginia? And in Pennsylvania, there's actually 3 different rate bands. The company, of course, has a little bit of a determination. There are some well-known companies, and you do pay more because they're well-known. Again, the coverage is exactly the same. And they tend to go up a lot every year as well. So, be careful of choosing a company just because it's brand name, because you're not getting any better coverage. You're getting the same coverage. And then, of course, your age. So as you get older, if you're delaying your Medicare because you're on group coverage, and then you get your Part B at 69, obviously you're going to pay more because you have been on Part A but not Part B. Now you're on Part B, you get that 6-month enrollment opportunity, but it's going to cost you more. Okay, difference between Plan G. We said Plan G, 130 to 180 a month. It's going to pay everything but the Part B deductible. So you have to pay the $257 deductible for this year. Plan N, about $25 cheaper. I'd say that might even be a little bit more like $30 right now between plans. But you pay your $257 deductible and you add 2 copays. $20 for a doctor's visit, $50 for an ER. You also see the excess charge of 15%. That is a real thing, but I've never had a client pay it. I've been doing this for quite a while. So I can't say it doesn't exist, but the provider has to be in a very certain category for them to charge an excess charge. Okay, so Plan G in my mind is a solid choice. Now, to give you 2 illustrations, a relative of mine went on Medicare November 1st of 2021, and Plan G, healthy individual, about the 15th of the month. Okay, I'm going to give it away. It was my brother-in-law because my sister calls me, and she says, Nevin, she says, oh, she's crying. She's like, you won't believe this, but Tom has had a significant medical event. He had a brain bleed, and he is being life flighted. They said that he's going to be okay. They think they can, as long as they can get him into an operating room. But how are we going to pay for this? And it was wonderful to be able to say, well, Patricia, it's going to be $203. Because in 2021, the Part B deductible was $203. And it was really great as a brother to look like a hero in his older sister's eyes to be able to say, it's just this much, okay? But again, I'm not trying to sway you one way or the other. They were paying a good bit every month for it, okay? So that's all that was necessary for them to pay. Now, I have a friend that lives in Holsapple. He's not a relative, so I won't use his name. And he has Plan N, and he had a heart attack by the side of his house. He calls his wife, doesn't call 911, he calls her, crawls to the car, and she takes him to the hospital. They life flight him to Pittsburgh. And he, oh, it's a long story. I won't get into it, but it's really funny, really, really funny. But anyway, it was August. He had already met his Part B deductible. He did not go to a doctor visit, and they waived the ER fee because if you are admitted, they waive that fee. So about 6 weeks later, I'm standing in church, and this guy goes to my church, and he walks down, and he just he's a big, burly guy. And he grabs my head, and he turns it sideways. I'm thinking he's going to snap my neck. My Medicare sales agents, the days are over. Anyway, he turns, and he kisses me on the cheek, and he says, that's from my wife. He said, we have gotten all of our bills, and we owe nothing. Okay, so good coverage. But again, I'm not trying to sway you to say, oh, you should get a supplement. But that is the reality. Those are true stories that aren't exceptional. They're the norm for this kind of coverage. Sign up for prescription. Okay, so let's back up. I'm going to stop talking about Medicare supplements, and we're going to talk about that one other part if you go with original Medicare, which is your prescription plan. Okay, so the sign up for a prescription plan is the same as Medicare, the 3 months before to the 3 months after your birthday. 60 days if you're leaving your employer coverage. Are there other special enrollment times? Yes. And one of the big ones that we use in Maryland is this state pharmaceutical assistance program. Because it's such a generous limit for income, folks are able to easily qualify for that, and yet gives them one additional time to change prescription plans, which sometimes is super helpful because in the middle of the year, who knew you now needed Xarelto or Eliquis or one of those expensive Januvia, Ozempic, just some of these very expensive brand name drugs. So the sign up is the same as Medicare, and you're going to see here in a little bit an Advantage plan is the same as well. Okay, a little bit more about drug coverage. There is a deductible. Now, not every drug plan has a deductible, but if they have one, it can't be more than $590. That's the amount you pay before your coverage kicks in. However, a lot of drug plans, the tier 1 and tier 2 medication, your lisinopril, your atorvastatin, your pantoprazole, those they aren't on the radar with the deductible. And so those will be a zero copay or a low copay depending on the plan. All right, so not every drug tier is affected by that deductible. Initial coverage stage, you pay a copay for each drug you're taking when you pick it up from the pharmacy, but you can't pay more than $2,000 a year. And you're like, $2,000 is a lot of money. Yes, but I have seen some people that are done paying in the middle of the year. And for them, this is a great blessing, great benefit. I will say this, only drugs on the formulary count toward the max out-of-pocket. I saw some folks when this came in last year, they thought that the formulary now didn't matter, but only the drugs that are on your formulary count to the max out of pocket. And then there's a catastrophic phase, so anything over $2,000, you won't have to pay for any of the medication for the rest of the year. Now, I'm going to give you one little illustration about this before we move on. There's a company that, and it doesn't matter the company name, but there's a company that has no deductible, okay? Now, it's a pretty expensive plan, but with the Maryland Senior Assistance Program, it ends up being like 14 bucks or something like that, okay? That plan doesn't have a deductible, but they still count the deductible toward the max out of pocket. That plan also doesn't charge 25% while you're in the initial coverage phase. They only charged like 40 some dollars, but 25% counted toward the max out of pocket. So literally I had people that their max out of pocket, besides their premium, that if they qualified, the state of Maryland paid for most of it, they were paying $300 to $400 for the year, and they met their max out of pocket because of the way the plan was structured. Again, I don't know how to tell you to find that other than you talk to someone you trust that will work through that and pay attention to your situation. Okay, this is, I hope this is not offensive to anybody. If you want to take a picture of that, and then you have to use somebody else's phone because it's going to be on your phone, so that's not how QR codes work. But this just goes to a HIPAA compliant form. You can send your medication in. Noelle or one of the lovely girls that work in the office will get that. They'll get it to an agent. They'll run your medication and contact you. So I only have this up here as an assistance. It's also, there's QR codes on other things, but it's an easy way for you to get your prescriptions taken care of. Now I'm going to go one step further and say this. There is a company right now, a prescription company, that doesn't contract with agents. They quit 2 years ago. It's pretty underhanded, but they did it. I guess they quit a year ago. Anyway, when you need that plan, what do you think we do? Hopefully I've earned your trust enough you know the answer to that. We help you sign up for it. Because I'm not going to say, well, because they won't work with me, I'm not going to sell it to you. I have to do that. That's my ethical responsibility. So I'm not just, if there's a company that we don't sell, which is only one right now, a Part D plan, but we're going to, for sure, we turn the computer around and show you the options. We'll make sure you get what you need. If you don't get a drug plan, I have folks turn their drug plan down. They even know there's a penalty and they still turn their drug plan down. There is a 1% penalty for every month, and that 1% is based on the average cost of a drug plan in the United States. And so somebody says, I don't want a drug plan, and then they're 72 and they need to get one now, they will be paying a penalty for it. There are things that take that penalty away: low income subsidy, QMB, SLMB. Those designations for low income will absolve the penalty. And that penalty is only applied if you don't have other coverage. So if you have group coverage, you're good. Okay, Medicare Advantage plans. We're coming down to the end here, but Medicare Advantage plans, Part C, the one that combines everything together. It's the other delivery method. All right, so I sort of put these slides a little bit differently because I wanted you to have the actual writing in your book. But it's a health insurance plan managed by a private health insurance company or companies that cover Part A and Part B services. They cover all Part A and Part B services. They're required to cover with at least as good a coverage as Medicare. And many of the plans, of course, cover prescription coverage. If you go to Medicare.gov and you type in your zip code and you look at the plans that are available, there's quite a few in Garrett counties that don't have drug coverage. And most of them are named like Honor or Salute. It's because of veterans. And it's certainly something you would perhaps want to look into if you are a veteran. Premiums are advertised as no premium or zero premium. You do have to pay your $185, but the reason it's inexpensive, again, I told you, is because Medicare is sending money for Acme Insurance Company is now on the hook if you're in the hospital for a month. When it was Medicare, they were on the hook for a month. So they're happy to pay money so they don't have to be on the hook. All right, sort of like if you own your own dump truck or you rent a dump truck, you're not on the hook if somebody else owns the truck, but if you own it and the engine goes out, you have to pay for it. Medicare is happy to farm that coverage out to an Advantage plan. Now, it has copays, deductibles, coinsurance, out-of-pocket maximums. Those are all things that are involved in Medicare Advantage plan. We're required to go through those with you. If you talk to anyone and they talk to you about an Advantage plan, they're required to go through the plans and the coverages because they could cost you thousands. But now the caveat again, swinging the other way, if you are paying no monthly premium and then you have $1,800 in a hospital stay and an outpatient procedure, but you didn't pay, the $3,000 that your supplement was going to cost, you're still ahead for the year. But you have to remember there's other moving parts like co-pays, deductibles, and co-insurances. Now, one other thing, I think it's on here, the network. Let's talk a little bit about, and I appreciate Lisa bringing this up, and I do want to spend a second longer on it, HMOs and PPOs. So if you have an HMO, you can't go out of network and have any coverage. But some PPOs are sort of PPO in name only, because they have such poor out-of-network coverage, no one could afford to go out-of-network, okay? So when you get a PPO, know that that's a good thing typically, but just be assured that if you go out-of-network and it's a 50% co-insurance out-of-network, you're exposing yourself to some pretty substantial charges. And I have had people, it was a mix-up, they were told it was in-network, it was actually out-of-network, and they ended up with quite the cost. So you want to make sure if you have a PPO, either it's a PPO with low cost sharing out of network, or you're at least aware that it doesn't have good coverage out of network. So then what's next? You got to make sure the in-network is big, right? You got to make sure it has a good in-network footprint so that you don't have to go out of network. Each plan has an explanation of benefits, the details, the premiums, the deductibles, the co-pays. It also will tell you about the additional benefits, the dental coverage and the eye coverage and the hearing coverage, and whether the dental coverage covers dentures or just your teeth and not any kind of replacement. I got ahead of myself. Yeah. So I would just caution you when we talk about gym memberships and healthy food allowances, just remember, I'm not a grocery salesman. If you're going to go for that, great. If it's icing on the cake, wonderful. We all love, well, maybe we don't love icing on the cake. I'm not a sweet tooth. I'd rather just have a steak on top of my cake. But anyway, the icing on the cake could be a food cart or whatever, but don't make your decision based on those ancillary, because you're buying peace of mind, right? And I want to help provide that. Advantage plan sign-up is going to be the same as a prescription plan, which really runs synonymous with Medicare, and there are those same special enrollment periods that can help you with making changes throughout the year if you have a life-changing event. All right, annual election period, October 15th to December 7th. That's for Advantage plans and prescription drug plans. Not Medicare supplements. Medicare supplements, remember, the only way to change them, if you're outside of that 6-month window, when you got your Part B, you change Medicare supplements based on answering health questions, or in Maryland, you can use the birthday rule. But you can switch a supplement any time of the year. And I help plenty of people move supplements. They bought Acme Insurance. Now, there is no, to my knowledge, company called Acme, so I'm not promoting or detracting from Acme Insurance. I don't think they exist, but if they do, it's not to my knowledge. But if Acme Insurance Company is charging you a lot and it's June and you're healthy and you think you can answer health questions, and we want to run you over to Yankee Health Insurance and it's going to save you $70 a month, which is not at all odd. The most I saved someone switching supplement plans is $2,870 some dollars, just by going from one Medicare supplement to another one. They were healthy, they were in their 80s, they were healthy enough to switch. So you definitely can switch a supplement anytime. But as far as the drug plans and the prescription plans, the Advantage plans and the prescription plans, the annual election period, or you can use the open enrollment period, which is sort of a new window that was opened up a few years ago. And what it does is it allows you to make Advantage plan changes only between January and March. So the good thing is, there's two good things. Number one, if you don't like the choice you made here, you have 3 months to figure that out and change. And it's also good because if a shady character pulled the wool over your eyes here, you can see clearly now to make the right decision here. And that's good because that keeps us on our toes. I'm all about accountability. It's a wonderful thing. You also, during that open enrollment period, you can change back to original Medicare. So sometimes people want to get a supplement. They're healthy enough to get a supplement. They can switch during that time. And the reason they have to use that time is because they need the Part D plan. They can get a supplement anytime, but they can't get a prescription plan to go along with it unless it's in that period. Okay. Obviously, there's quite a few life-changing events, a lot of other enrollment periods. Now, one last thing, then we'll take some questions. Low-income subsidy is for folks who they don't qualify for any kind of Medicare savings program like QMB, SLMB, full dual Medicaid, Medicare, but they still need some help with their prescription plan. This will pay up to, I don't know what it is right now, it's around $40-some a month. It will pay towards your prescription plan, and it will throttle your copays down. Now, you heard, I told you the Maryland Assistance Program. I don't think that's on here. Yeah, it's not. The Medicare Maryland Prescription Drug Assistance Program pays up to $75. You're like, well, that sounds awesome. I'll take that instead. Well, you can't. If you qualify for low-income subsidy, you can't get the Maryland Assistance Program. However, this helps you in a different way because it also throttles your copays down, where the Maryland Prescription Drug Assistance Program just pays you that $75 towards your premium. All right, so low-income subsidy will help, and there shouldn't be an I in there. It's SLMB, so I always say it this way, but it's SLMB, Specified Low-Income Medicare Beneficiary. It pays your Part B premium, and you also get the LIS benefits. And then there's QMB, Qualified Medicare Beneficiary. Now, I learned something, because there's people in here that do more of the low-income stuff, and so I'm always trying to learn. And in a sense, I had the right idea, but QMB pays your Part B premium, and it also prevents the billing of coinsurance. I thought the state paid the coinsurance, but apparently it just prevents the billing of it. And so I found this little article, and it's from a few years ago, but it says that there was quite a problem where QMB groups were still wrongly billed. So if you have QMB, pay attention, because you're not, it's not actually legal for them to bill you for Medicare copays and things like that. And then QMB Plus is when you have dual eligible Medicare and Medicaid. Now, if you have those plans, you don't really need anything else, but you may want to consider an Advantage plan. You can't have a supplement, but there are Advantage plans that actually provide a lot of extra benefits, since the state and Medicare are taking care of all your copays, they're taking care of your Part B premium. They'll provide some very enhanced benefits, and that's where you can get some grocery card help. You can get some, if you have a chronic condition, they'll actually give you an additional amount of payment for grocery. You get over-the-counter benefits, things like that. And then QDWI, something we rarely use, but it is for that person that doesn't have a work record and they don't have anybody else to help them with a work record to get Medicare, so they'd have to pay for their Part A, except that they don't have the income to support that. This is actually a program that pays for part or all of their Part A. All right, let's go one at a time to the recap. I think we did okay. We had a little bit of time for questions. First, history and structure. I don't think anyone's going to grill me on Lyndon Johnson, because that's about all I know is his name. I apologize for that. Somebody probably could tell me more. But what about the structure of the A and the B? We could say A, B, C, and D. Any questions on that? A and B are facilitated by the federal government. C and D are private health plans. Sign-up times. Any confusion or questions on sign-up times? You have to sign up. You have to take Medicare before 65. So that's a great question. You don't. If you have group coverage, the answer would be no. If it's creditable group coverage, a standard group coverage plan, you don't have to, or you're on your spouse's insurance, you don't have to take it at 65. Now, Part A, a lot of people take because there is no premium, and it's going to coordinate benefits with your group insurance and throttle down your hospital costs if you would happen to need that. So most people have group coverage, they have Part A. only. Now, 15 years ago, if you had group coverage, we never ever said this, but we say it now. If you were on a spouse's group coverage and even your own group employer coverage, you may want to at least compare what it costs to be on Medicare and a supplement or Medicare and an Advantage plan and the kind of coverage you're getting versus your group insurance. The reason is because group insurance over the last 10 to 15 years has fallen apart, where you used to have $100 deductibles and a $500 deductible was huge. Now, I talked to someone this week has a $6,000 deductible for their group insurance. Well, someone like that, of course, is more than likely going to profit from just going to Medicare, paying the $185, and then getting a supplement or an Advantage plan, because there's no deductible, or with the supplement, there'd be a $257 deductible. Anything else? All right, the two delivery methods. Whoops. Medicare Advantage versus supplements. I know that's the quintessential question that everyone has to deal with when they go on Medicare. Yes?
Actually, mine was for, is there a guidelines for Medicaid on the Medicare website, or you have to go specifically to Medicaid?
So the best way I help people with that is if you go to the Social Security, not like you're logging in, you just go to Social Security, or if you go online, and again, we can help with that, you can check if you qualify. It says see if you qualify. You click that, it asks you some questions, because there are resource limits. There are certain situations where you have spend down. If you're really close but you're a little over, once you have so many expenses medically, you'll have spent down to where you can get one of the Medicare savings programs. So there are general income and resource guidelines that we can go over. Those change a little bit every year based on the poverty level.
Does it include, though, if you have retirement, things like that, is that money included in?
So the generic answer would be yes. It's going to be counted as a resource. The one reason I would say the generic answer is if you have like a Roth IRA, that typically doesn't count the same way. For some programs, it still does count. So there's unfortunately moving parts, but there are guidelines that at least get you close to say, I think I qualify or I don't qualify. I mean, I tell people if you're a household of two and you're around 30,000, you're out. But if you're under 30,000, household of two, again, don't hold me to this, please, but you're going to start from there on down, seeing where you get some extra help. Yes?
When you talk about vision and dental coverage, is there any configuration with Medicare and supplements that provides any kind of vision or dental?
So I appreciate that question. I actually was going to put in ancillary coverage section, but I knew I was pushing it on time, and it really isn't Medicare, so we're allowed to talk about it with Medicare, but I just thought I wouldn't, so I appreciate the question. There are standalone prescription plans. There are plans that will cover just dental. There's some that have dental and then a vision rider. I honestly have always struggled, and you're going to say, boy, this guy's not a very good agent. Where did Mountain Laurel get him? But I've never been a fan of ancillary products, because I just want to do what I do very well, and I don't want to do anything else at all. I realize that's probably not the best idea. So Heston, my son's here. I'm sorry I didn't introduce Heston. Well, I'll talk a little bit about them right at the end. But so I've told Heston when he comes on, he's got to learn more. And we're contracted with Manhattan Life and Emeritus and several other companies, Physicians Mutual, with those kind of products. We definitely can go over an explanation of benefits. There are standalone dental, vision, hearing plans. They aren't bound by any kind of enrollment time. So sometimes people get their Medicare all figured out, and then they say, hey, let's get together in a couple months. Once I still realize I have my shirt on and I have Medicare and I'm still okay, we'll get together and talk about those. So those are definitely options as well. Great question. It's not, no. So unless you get it through an Advantage plan, it's not going to be anything that has anything to do with Medicare. It's going to totally be standalone. So that, no, very, very good question. Very good comment. Thank you. Yes, ma'am.
another question. With the Plan G, on one of your slides, it says Plan G premium 130 to 180 a month.
Mhm.
And then on another slide, it says, what is the cost G plan? 100 to 180 a month.
Okay, so I think is the one part Plan G or is the one just Medicare supplement? So that's Plan G. The next page over is just the average Medicare supplement rate. So that's including N. That's including Plan N. And Plan N is cheap, less expensive. So 100 to 180 is paint with a broad brush, but that's going to get almost everyone in this room with a typical Advantage plan in either West Virginia or Maryland. That's why there's such a big divergence. Great question. No, that's fine.
Where can you get the formulary if you're on a lot of different prescriptions and want to look them up yourself, as opposed to having one of your people do it? Where can I get a formulary list?
I would say you'd have to look through the website. I don't know. We used to get printable ones, but we don't even get those anymore. So, I mean, the best thing to do is you go to Medicare.gov, find plan, type in your zip code. Thank you all. And you can then, it'll tell you what plans cover all the medication. And that's Medicare.gov, by the way, Medicare.gov, find plans, type in your zip code. If you get any kind of extra help, you say that. You tell them what drugs you take, what pharmacy you go to, and it'll spit out the plans that'll work best for you.
Now, do they limit what pharmacies that you can go to?
Well, the plans can, yeah. So obviously, some folks, you know, they love to work with Greg's, and so we try to find a plan that will work with Greg's. Some companies say, nope, we're not going to work with them, so we try to steer a different direction.
And if you get a Plan D for the prescriptions, is there a cap on their premium?
I'm not aware of any kind of cap. I mean, basically, it doesn't change during the year. But so when you enroll in that, if it's an $89 plan, it's going to be $89 all year. I don't know if there's like an upper. Well, that's why, yeah, for the next year, you would want to definitely check your formulary and say, do I need to switch plans? That's why during the annual enrollment period, I would recommend everyone has someone or you yourself run your medication list to make sure, because there are significant changes every year to that. Particularly this year when we had the 2,000 max out-of-pocket change.
And just one other question. At the very beginning, you had mentioned something about 63,000 and then over 100,000 or something. What was that?
Okay, so several different things there. 63,000 is the income limit for people who have the Maryland Senior Prescription Drug Assistance Program for a household of 2 to qualify for the MDS-PDAP, the Maryland Assistance Program. The other part, the 100,000, was a sort of a generically given number for people who are going to have, if they're a single household, they're going to have to pay more for their Medicare Part B. So that's the Part B premium issue. All right, limited income help. Any questions? All right, please, of course, please avail yourselves. Again, Lisa will, I hope, tell you, I hope she's got enough feedback to know that I'm said no agent ever. Well, why don't you think about this for a week? But I say it regularly. Because if somebody's not sure, I want that time if it was me not being sure. So we regularly get together twice. And I don't have any problem with that at all. Because one, my persistency rate of my clients is extremely high, and I'm very thankful for that. It's because you know, there's never been like, oh, sign right here. You love this policy. Sign here. No, it's we take time. We become friends. We are your neighbors for trusted coverage at the Hirsch Group. Upcoming changes with Medicare and the big beautiful bill. The biggest difference you're going to start to see, and it's going to be a few years out, is that cost control of certain pre-authorizations happening with Medicare. Now, you know, I'm taking a risk here, but back in the early 2000s when Obamacare came on the scene, the right said, oh, it's going to be terrible. But now, you know, with Trump doing something, the left says, oh, it's going to be terrible. There are nuances that are going to be a concern, but you're going to be okay. And we're here to make sure that you're okay, regardless of what happens. All right? How can we be your neighbor? Let us know. We want to be your neighbor. All right. Thank you guys for being awesome.